My name is Dr. Benjamin Enti. In the following slides, we will review the point-of-care ultrasound exam protocol for soft tissue. Our objectives for this ultrasound module is fourfold. We want to first help you to understand the indications for skin and soft tissue ultrasound, then be able to identify normal soft tissue when you compare it to cellulitis, abscess, or in some cases, necrotizing fasciitis. Further, we'll also look at how you can use this modality to identify a foreign body in the soft tissue and review some tips and pitfalls to improve your exam. The incidence of skin and soft tissue infections in the ED is about 6 to 12 per 1,000 ED visits. Now, cellulitis risk factors include trauma, immunosuppression, vascular disease, and sometimes prior history. Of course, as we know, management includes oral antibiotics when you're considering just cellulitis, incision and drainage for an abscess, and ultrasound-guided removal or surgical removal of foreign bodies as well. What makes point-of-care ultrasound fantastic for skin and soft tissue infections is that, of course, it's safe, it's inexpensive, it's rapid, it's repeatable, and it's non-invasive. So point-of-care ultrasound, as we know, is superior to clinical exam alone. Has a higher sensitivity and specificity in the order of 98 versus 86% and 88 versus 70% respectively. Additionally, literature shows that point-of-care ultrasound changed patients' clinical management of cellulitis 50% of the time and prevented unnecessary invasive procedures. When a patient presents with skin and soft tissue infection, clinical differentiation of cellulitis from an abscess can often be challenging. So the added use of the ultrasound can really help paying attention to the size and the depth, the proximity of the infection to other structures, and then assessing for other pathology as well. And then in some cases, there's the use for real-time guidance when you're doing an incision and drainage procedure. Indications for the use of ultrasound to detect foreign body in the soft tissue is also very important, in that if you miss the foreign body, can cause inadequate wound healing or infection. Plain radiographs are something that we commonly use, and it's usually adequate for radio-opaque foreign bodies. Ultrasound, on the other hand, is able to detect the entirety of the foreign body that is in the soft tissue, no matter if it's radio-opaque or radiolucent. The transducer of choice is the high-frequency linear transducer. You want to acquire these images in two orthogonal planes, one in the long axis and one in the short axis. Make sure to sweep through the entirety of your target soft tissue, whether it be an infection or whether it be a foreign body. The image surrounding the anatomy itself can be useful to demonstrate additional anatomic landmarks or nearby vascular structures. And when the patient can tolerate it, sometimes a little compression can help to assess the contents in the abscess itself. Lastly, you want to also optimize your image by using color Doppler to assess the structure itself. When performing this exam, you want to be as comfortable as possible. So position yourself in a manner that the device is directly in your line of sight. And then it's important to make sure you orient the transducer indicator to the image displayed on the screen, which is usually the right side of the patient when possible. Notice the examiner's hand position in this image with the indicator not shown in this image, but is usually on the patient's right side. As with any image acquisition, understanding the anatomical structures are important to your exam. Note the organized pattern of the epidermal, dermal, single echogenic bright layer on the image to the left. Now, also note that there's a subcutaneous tissue that's directly underneath that, and that's hypoechoic. You get these thickness of layers that vary depending on the region of the body and the habitus. And when you get deeper, you find structures that you want to avoid, including the muscle, the tendons, and the blood vessels as well. Blood vessels tend to be anechoic, linear, or circular structures. And then deep to that, you can find bones that are bright, echogenic cortex with posterior shadowing.